We just heard the story of how an unforeseen infection led to an emergency heart surgery. But what are some of the steps you can take to hopefully avoid trouble and keep your heart healthy? I sat down with cardiologist Dr. Kevin Boran to get his thoughts. What are some easy steps, some things people can do to help prevent becoming your patient in the first place?
A good diet and exercise is important. And that's kind of a given. A lot of people are focused on that. I think that a lot of people now have incorporated exercise as part of their regular routine. And I think at least 30 minutes of aerobic exercise a day is great. It's great for cardiovascular conditioning. It's great for mood elevation. It's great for affecting your blood pressure. It helps with your lipids. It helps with everything.
There's your genetics. How do you overcome those things?
You got to pick your parents well. There's 5 major risk factors for getting premature coronary artery disease: high blood pressure, diabetes, high cholesterol, tobacco dependence, cigarette smoking, vaping, chewing tobacco, and a family history. You can't change your genetics. Your family history is your family history. I think where those become important is if you have a family history of coronary artery disease, you should be more attentive to the other risk factors that you can change. So for the average person, 45 years old, a blood pressure 130/85 would be acceptable. But if you have a family history of heart disease and you're bumping up against that with your blood pressure, you probably want to get that lower. Primary care providers are really the key thing to risk factor modification. The better the primary care doctor does at taking care of the risk factors and endorsing the healthy lifestyle, the less they're going to need to see the cardiologist.
But if you could give somebody a takeaway at the end of this and say, keep this in mind, you should be in decent shape.
I think that the takeaway is pretty straightforward. People are living a lot longer now. It's tough to beat the calendar. The calendar usually wins. But one way to turn back the hands of time is to have that healthy lifestyle where you eat well and exercise. Beyond that is, paying attention to those major risk factors. We used to look at diabetes as being a problem. Now we're looking at pre-diabetes, we're looking at metabolic syndrome. And a lot of primary care doctors are doing a great job of hopping on top of these things. So there's really no excuse for anybody who's seeing their primary care physician not to have all those dots lined up and have good blood pressure, good lipids, and good diabetes. And that's basically preventive cardiology.